Disneyness is wearing off a little bit. I actually think I can speak now properly. So that's a hefty brace, guys. I tell you what, I didn't think it was going to be that thick, but I brought some good shorts on to make sure that it would fit over, be baggy enough. So I think we should be okay with that. Yeah, I'll be ready to probably leave here in about 10 to 15 minutes. And, go ahead and we'll start to...
Got to see the physical therapist.
Yeah, actually the physical therapist is going to be coming by. He's going to explain to me some of the exercises I'll need to do.
Make sure you can get by on crutches.
Yeah, exactly. Got to make sure I do the crutch thing, and then I should be good to go. So I'll fill you in as more information comes through. But currently right now, my surgery was just taken care of. I'm just done. I am now coming out to... So the physical therapist is now coming in just a moment and is going to bring me some crutches to make sure that I can basically be able to get to walk from here to the car. I assume, I don't think I'll do a wheelchair. I think I'm actually going to be able to do the crutches. And you think I'll be in a wheelchair?
Why fight it? Why do it the hard way?
Who knows, right? Exactly. But either way, physical therapist will be back in a moment. It's going to teach me about probably some of the exercises that I'm going to need to do for recuperating. And apparently, every time that I wake up, I should start doing extenders and point on both legs to do it at the same time. And that basically is going to be the start of me making sure that I'm having good fix. And here he comes.
Do you mind if we do this? We've been
All right.
filming everything.
So basically, Doug, what I'm doing is I'm just filming my entire experience from the top to the bottom. So that way, if anyone ever has an interest in knowing exactly all things that happen, they have a perfect way of being able to view it. Plus, my family's all in California, a lot of them. And so they can actually get to see the whole entire thing. Yeah, be a part of it, part of the experience.
Okay. Can you scoot back this
I absolutely can. Sure.
Good. Well, I'm Doug, physical therapist. We're going to go over a few exercises this week.
Okay.
They're real simple.
Okay.
This week is a week of healing, all right?
Fair enough.
Take it easy.
Absolutely.
And especially today,
Okay.
get it just elevated up on some pillows.
Okay.
Run your Iceman as much as you'd like. You
Okay.
don't want. You get too cold, it gets your Sherman. You
Fair
can take it
enough.
off for a little bit.
Sure.
But for the most part, you can run it as much as you'd like.
Okay.
The only exercise you want to start today is ankle pumps. So,
Right. Here.
so every hour when you're awake, do 20, 30 ankle
Okay.
pumps.
Okay.
All right?
Okay.
And that just gets the blood moving here. We get this calf moving, the muscles moving, so pump the blood back to the
Yep.
heart so we
Yep.
don't get any blood clots forming.
Correct.
Okay?
Okay.
So that's it for today.
Okay.
That's the only exercise today. Then tomorrow you can start these other two.
Okay.
We're going to do them on your good leg because that one
Absolutely.
you got the block, you got the
Absolutely.
nerve block. So the first one is a co-contraction, meaning we want both the hamstring and the quad contracting at the same time. It kind of stabilizes the knee. So
Okay.
how to do that is you push your heel down into the bed. Push
Okay.
it down my heel, yeah. Not so hard.
Okay.
Yeah, push, you can push. Yeah, and then tighten that up as you're pushing.
Mm-hmm.
Good. Just like that.
Just that's it.
The natural tendency when you tighten your quad is your heel pops up.
Yes.
This one we
You
want
want
you
to
to
keep it
keep
down.
pushing down.
Absolutely.
Keep pushing the heel down
Sure.
to keep those hamstrings
Sure.
engaged.
Fair enough.
And then engage the quads and hold for a count of 5. 5 seconds. 1, 2, 3, 4, 5. All right?
And let go. And 1, 2.
So you'll be doing that with the brace on.
Okay.
Okay?
Yep.
Start with 10 to 15 reps tomorrow, whatever you can tolerate, okay? And then over a couple, 3 days, build it up to 30 repetitions.
Okay.
He likes you doing 3 times a day, like morning, afternoon, evening.
Fair enough. Okay.
All right? The only other exercise you'll be doing is just straight leg raises, okay? You know, about so high.
Okay.
Slow and deliberate.
Right.
When you come down, relax the quad.
Okay.
Tighten it up again. Lift.
Okay.
That relaxing and engaging it again exercises the muscle better,
Okay.
as opposed to just going up and down, okay? Okay? You'll have the brace on, it'll be heavy.
Right.
So if you need help, either someone can help you initially till you can
Okay.
engage it and do it yourself under your heel,
Okay.
or you can get a sheet, you know, put it in
Pull
front
it
of
up,
you
yep.
and just
I have
help
some
it up.
ropes at the home too, so
Rope,
if I need
whatever,
to do that.
TheraBand, whatever
Yeah,
you
exactly.
have. Yeah.
Exactly. Mm-hmm.
Okay?
Okay.
Until you can do it by yourself.
All right.
And once again, start with around 10 and then build up to 30.
I do this about 7 days, correct?
Yeah, you do this till you see him next week.
Next
You'll-
week. Okay.
Are you guys up here or down?
I'm Salt Lake.
He has a clinic down at Tosh on Wednesdays down in Salt Lake. Mondays up
Midville,
there.
right? Midville location?
Yeah, well, it's
I think
Murray.
that's oh
It's
Murray, yeah,
at
Murray,
Tosh.
yeah. So that's where I'll be going.
Yeah, so
That's
it's
what I
Wednesday
understand.
usually. So call the office and they'll schedule the time.
Okay, perfect.
Okay? And the only other big thing is just non-weight bearing on this.
Of course.
Okay?
Absolutely.
Now you've got crutches, so have you been on crutches for a little bit then?
You know what? I actually purchased the crutches because when I had my injury about a month ago, I actually was using them, and I had a boot that took the pressure off from the leg and everything. It was a great system, kind of came up with, and so I got a little comfortable with it, but probably not as talented as like I've been on them all my life.
Now we got to keep his 7-year-old daughter off jumping on it.
Yeah, exactly. But yeah, no, I feel pretty confident about
All right.
it. I don't know how to set them up as far as to know where I should have it. I guess you could say that was probably one of the most challenging things that I did experience when I was trying to figure it, like it was too high or too low. I'm leaning too high, and so that will help me. Yeah, absolutely. That'll help me.
It might be a little high for you.
Okay, fair enough.
But your head's feeling good. You're ready to go.
I feel
Get
good.
out of here.
Yeah,
we'll
I'm
get
feeling
some
really
shoes
good.
on
Yep,
this foot.
Okay.
Okay, you ready to?
Can't really do the other one.
No. Probably gonna be too swollen with all the wrapping. And
No, I
stuff,
understand that too. Yeah. All right.
All righty.
Grab my hat.
Sure.
Can't go anywhere without a hat.
This in your bag here. Take this
Yes,
bag.
please. Thank you. Okay.
Yeah, I'll get everything for him.
All right.
I'll make sure everything's cleaned up.
Bag.
Do-do-do-do.
Let's put this. Do you have your? Here's your folder. Let's put this.
Yeah, we'll just stick that inside.
Give me a little folder.
I think there was something, but maybe.
Okay. Let me help you down. We'll just.
Thank you.
You just sit on the edge for a minute.
Okay.
Trying to get used to
Sure.
your head.
Sure. I was saying the most awesome thing about it is I blinked and that was it, and I was done. I was like, this is great.
Thank you.
Okay, when you come up with crutches, when you're by yourself and stuff,
Mm-hmm.
you grab them like that, and then you push from the chair or bed you're coming up from.
Fair enough.
Come up on that good leg.
Okay.
Now you can rest it down a little bit, touch. Just don't
Sure.
put weight on it. Just
Sure.
a little balance
Sure.
till you get your crutches on there.
There we go.
And those aren't too bad, really.
Yeah.
You want just a little slight bend
Okay.
in your elbow, almost straight. You
Okay.
know. Not too much. If you get too much bend, you can't push down.
Like your legs on a bicycle.
And you just want to be able to get a finger or two under that, which I can do.
Okay.
On that. So this is a set of 5-10, should work a pretty good set right there.
Excellent.
Okay? So you put the crutches forward first, and then you're just going to push down and just kind of glide with the other hand. Foot, okay? So all the weight's on the hand there. Just, let's go and do a couple things here.
Sure.